Good evening. This is Melissa Morton, Director of the CDC, coming to you with an announcement regarding recent influenza vaccination. It has been reported to us that the influenza vaccination has had lethal repercussions. In accordance with the FDA administration, I come to you to inform you that the vaccination has been recalled. The vaccination that was given between the months of October to December has shown to be lethal. We have had numerous astounding cases of paralysis and also an alarming number of deaths in 9 states of the Northeast and Midwest sections of the state. The FDA, the NHI, and the Health and Human Services are working together to get to the heart of the matter to find out the main cause of this injection. The injection was, the vials were placed in a bin with the vials from September's vaccination. So we do not know which facility was distributing these vials, this influenza virus, influenza vaccination. Public health concerns at this time are who should be getting the influenza shot, and that is no one at this time. Those who have already had their flu shot before October have shown no side effects whatsoever. It is just this batch between October to December. Every effort is being made to facilitate those who have been infected. There are open facilities for those experiencing symptoms from this influenza vaccination, which include paralysis and or death if your loved one has died as a cause of this influenza vaccination. We ask that you contact the CDC we can get a head count of exactly how many people have been affected by this vaccination. There is, like I said, no known cause at this time, but we will continue to monitor the situation. There will not be a new flu vaccination put out at this time. They're working diligently around the clock to find out exactly what went wrong. And we have not ruled out bioterrorism as a source of this vaccination gone awry. Right now there are several different resources for you in place that you could use as far as the net, and that is the cdc.gov, the fda.gov, also the hhs.gov, and the NHI, which is the resources for you, so that you could check out exactly what information you should need to know should you have just received the influenza vaccination. This is an alert letting you know that we were just informed, so we are making the public aware as well as we are finding out. So there will be more details as more information will be given to us. So I just want to say, the best way right now that you can prevent the spread of the flu is basically the same things that you would do in any other influenza situation, any other flu season. Hand washing, avoid going out if you're sick, avoid going to work if you're sick, avoid eating out in restaurants if you're sick. Basically just stay home if you're sick. If you have young children that you care for, see if you can have someone else care for them. Basically the whole family, if they're sick, should be quarantined to the house, at your discretion, of course. We ask also that you do not use public drinking fountains as a precaution. Do not share water bottles or glasses with non-family members, non-immediate family members. There is also no cause to shut down government and state buildings at this time. There will be a dismissal of all educational buildings until further notice. So all schools will be closed and all court offices will also be closed as a result of this, awry the situation. Those states that were seriously affected by this lethal injection are, like I said, in the northeast sections as well as the midwest sections of the state. Those include Rhode Island, Vermont, New Jersey, New York, Pennsylvania, Ohio, Michigan, and Indiana, just to name a few. These were the highest number of cases reported to us at this time. So as I said, federal agencies are monitoring the situation, and we have implemented a few guidelines for you, the general public, to stay healthy during this time. Check on the elderly. Be careful with children. And again, just stay safe during this time. And when we have more information, we will inform you. Thank you. Have a wonderful night.